Many women come and ask me, are there any non-surgical ways of increasing breast size? They ask, it is understandable. Everybody is scared of surgery and nobody wants a surgical procedure on their body. But as of now, the breast augmentation is possible only with surgery. There are no non-surgical methods or ways by which you can get your breast augmented. No massage, cream, injection or any other tablet will help you in augmenting size of your breast. There are only two surgeries which are helpful for the to increase the size of the breast. They are autologous fat transfer and placement of breast implant. Both methods have got their own advantages and drawbacks. Autologous fat transfer is a specialized method of fat injection in which your own body fat is removed from certain body areas like tummy, buttock, thigh, back. This fat is processed and purified, and this purified fat is injected into the breast to augment their size. This is a very natural way of increasing breast size. This is your own fat, own body fat, which is removed from your own body and injected into the breast. So the chances of allergic reactions or the fear of having something foreign material in your breast is not there. So this is a very natural way. And the biggest advantage is the fat which stays in breast, it stays lifelong. So the result of autologous fat grafting remains lifelong or for a very longer duration. But this process has got three drawbacks. One, the first drawback is you need to have a good or adequate amount of fat on your body. If the adequate amount of fat is not available, then this procedure cannot be used in that woman. Second, some amount of injected fat is lost over next few days or weeks. Generally, the general estimation is around 20 to 30% of fat is lost. So while injecting fat, we consider this fat loss and inject 20-30% more fat into the breast. But we don't have complete control over the fat loss. Sometimes more than 30% of fat is lost. Then this results in suboptimal result. That is, we get the breast augmentation of size which is less than the desired one. The third drawback is if the desired augmentation is not achieved, then in this process, in the process of autologous fat transfer, we need to do certain touch-up or repeat procedure after 6 months or a year. The third drawback, or you can call limitation of autologous fat transfer, is we can increase the breast size by moderate amount. That by this method we can increase the cup size by 1 or 2. That is, we can increase. If you are having a cup size of A, we can increase to C or B to C, because major breast augmentation is not advisable or cannot be done with fat transfer, because if we transfer more amount of fat, the amount of fat loss will be more, and generally if somebody wants a very busty look or big enhancement in breast size, we generally advise for the breast implant, and this autologous fat transfer is generally good for a woman who just want their mild to moderate size enhancement of their breast. The best person for autologous fat transfer is the one who are contemplating to undergo or who are looking for liposuction for body contouring. Like if somebody is undergoing liposuction for tummy or thighs to get the contouring of that part, then the breast augmentation can be combined with this liposuction, because in liposuction anyways we remove the fat, and instead of discarding this fat can be used to augment the size of the breast. So as I said, breast implant and autologous fat transfer, both methods are good, but we have to select patient properly. So generally in my practice, I advise the fat grafting in women who are already looking for liposuction. The second method of breast augmentation, mostly everybody knows, it's very popular method. Probably it's a commonest cosmetic surgery done in women all over the world, that is placement of breast implant. In this method, we take a small incision under the breast. There are other different methods also there are different incisions and different pocket size, but generally a small incision is taken under the breast. We create place under the breast tissue, that is below the chest wall muscle or above the chest wall muscle, that is between breast and pectoralis muscle, and one appropriate size silicone implant is placed there. The biggest advantage of this method is in a single sitting you get a desired amount of augmentation. No touch up or repeat procedures are required. The result is almost immediate. But the drawback, as I said, many women who come to my clinic, they have some fear of having something foreign material in your body, and that fear is always there, and there are certain problems which are pertinent with the silicone breast implants, like the complications like implant displacement, implant rupture or capsular contracture, which are not there in autologous fat transfer. But if somebody is looking for a busty look or moderate to big size of breast augmentation, the implants are advisable, because implants will definitely give that result which is generally not possible with autologous fat transfer. So again, we have to select the patient properly depending upon her expectations. If the woman is looking for mild to moderate amount of augmentation, she is looking for body contouring and liposuction of some other body areas, then she is a good candidate for autologous fat transfer. But if anybody doesn't have a good amount of fat over her body, or she doesn't want any touch up or repeat procedures, and she wants result in one sitting, or somebody wants a very busty look, then it is always advisable to go for silicone breast implants. Both autologous fat transfer and breast implants surgery are daycare surgery. They take around 1 to 2 hours. It is done under general anesthesia, so patient is comfortably sleeping. They don't feel any pain. Even after the procedure, there might be some discomfort in operated area, but severe pain is generally not seen after this procedure. The downtime is generally 3 to 4 days. After that, you can start your daily routine. You can join your work back after 4-5 days. So downtime is not much. Both the methods of breast augmentation are very safe. The chances of complications are very rare. Most of the complications are minor, like some bleeding, pain, infection, which can be easily managed. The chances of severe complications are extremely rare. So if you are looking for breast augmentation, you want to know more, please contact us. You can contact us on or WhatsApp us. We'll get back to you. Thank you.